Hi, I'm Dr. Kevin Bergman, family physician, co-founder of Global Ultrasound Institute, or GUSSI. We're an organization that is passionate about POCUS education and training, and everything we do is focused upon getting healthcare practitioners and whole health systems to that place of confidence and competency with POCUS so they can safely incorporate this game-changing new approach into their day-to-day patient care. And we do this through a structured hybrid of online didactics on our learning platform you see here, in-person hands-on workshops, longitudinal tele-ultrasound mentorship, and scan review feedback. And it's noteworthy that everything we do is, number one, device agnostic and independent, two, evidence-based and expert-driven, and three, global and accessible. We've translated the site into 22 languages. And number four, is really clinically focused. We're all educators and healthcare practitioners seeing patients, and our focus is not only on acquiring and interpreting those images appropriately, but also upon the clinical integration, where the rubber really meets the road on the if, how, and why this POCUS scan ought to impact your medical decision-making in patient care. So I'll start with a brief tour of our end-to-end learning platform we call ScanHub, which includes courses, you see here, an integrated device-independent scan archive and feedback software, a performance dashboard, an AI chat assistant, longitudinal mentorship portal, and more. So first, our online didactic courses. This is where many begin their POCUS journeys, and we currently have 5 courses. POCUS Essentials, you see here, obstetrics, pediatrics, musculoskeletal, liver, with more on the way like hospice, critical care. And each course is organized in this same way with modules that you see here up on the top of the screen and topics within each module. And for example, this POCUS Essentials course has 19 modules and 125 topics as well as 99 quizzes. So selecting just one of these modules, such as cardiac echo, and just simply click on the icon, it'll bring up the topics under this module. And we've organized all of the different modules in this same way. What is the literature behind doing this focused cardiac echo scan? How do you actually do it? What does pathology look like? How do you troubleshoot it if you're having difficulty acquiring the images? And then how do you integrate all of this clinically into different clinical scenarios, as well as a summary? And so just to give you a taste of the content itself, you can just simply click on one of these tiles, and each of these represents about a 10 to 12 minute video, and I'll show you an example of these right here. These are all meant to be very engaging, direct, clinically oriented, really right to the point in a way that doesn't give the learner too much information so that it's overwhelming and off into the weeds, but also on the other side, not too little and too sparse so they're not going to feel really empowered to be able to pick up a probe after these didactic video topics. So we've worked thousands of hours on these videos and received really incredible feedback on them over the years. So here's really just an example of one of these topics within one of these modules. And of course, it's all very clinically focused, appropriate for really any level of learner, but focus more on the early learner. After each one of these topics, we have a written summary that's quite detailed and comprehensive questions to make sure that that learner really got the main point of what was trying to be communicated. And here, I guess, is as good a time as any to show you that we have actually translated our website into 22 different languages. So for example, here is German, and here is the French version of the site, as well as Spanish, as well as Arabic, Chinese, and Hindi, and multiple other languages. And as you can see, it's really quite easy to move around to different topics here in the left-hand sidebar. Musculoskeletal, here all the different topics under musculoskeletal in the POCUS Essentials course. And worthy of mention that we always start the courses really with the basics. This is designed for anybody to be able to learn how to do POCUS who hasn't, even touched a probe before. So we always start with the basics here. So that's a bit about our content and our courses. We have OB essentials here, as well pediatric essentials and musculoskeletal essentials here with all of these different modules and topics under these modules, as well as our liver essentials, and adding more and more courses as we go. We're now also very proud to have incorporated a cloud-based ultrasound simulator as part of our ScanHub learning platform, where anybody, even without access to an actual probe, can continue on their learning journey, understanding how the images will change with the probe movements and starting to make those 3D anatomical, sono-anatomical connections to 2D images. So created 1,000 pathologic cases, simulation-based cases for things like gallstones and hydronephrosis and abdominal aortic aneurysms and liver lesions and obstetric abnormalities, pneumonia, heart failure, etc., to start to see more and more pathology, which brings learners to a place of more confidence and easier recognition of these patterns when they actually see them in real life. After having learned these scans and watched the videos and seen the summaries and answered questions, now it's actually time to do scanning themselves, do really practice scanning. And so it's really important to actually get feedback on those scans, which is why we built our own integrated device agnostic scan archive and feedback system. And you can see examples of scans that I've done here. So now, no matter the ultrasound device you're using, cart or handheld, Butterfly, GE, Sonosite, or Philips, you can quite easily upload your saved scans either via our web or mobile application in order to archive them for your own portfolio, for credentialing, share them with anyone in the world, or receive that very important feedback on them as you continue on your journey to competency with POCUS. Our expert Gussie quality assurance team provides timely and comprehensive scan review feedback as a service. And for those individuals and groups who are using our platform, they have the ability to use this software as their own QA system. And in fact, hundreds of residencies and health systems around the world do exactly that. So these foundational components, the scan archive, the scan review feedback, and the content all come together and come to life in the dashboard. If you are a part of a group, you can see how all of your group members are progressing at a high level to understand who might need more support, and you or the individual can get a more deeper, granular view of their own performance in the dashboard by seeing the progress on the modules, quizzes, and scans, and seeing not only how many have been reviewed, such as this particular learner right here, but also the scan types themselves, how many were fast, DVT, gallbladder, echoes, etc., and how their own interpretation compares with the expert interpretation here. That way they can see their learning edge and where they need to focus and where they are now in their own arc of learning. Other tools, the pathology gallery, seeing lots and lots of examples of pathology and recognizing those patterns versus normal cytoanatomy is a critical component with POCUS. And for this reason, we offer the pathology gallery on the platform, which has thousands of pathologic video clips and images for many different scan types, and we continue to augment it each week. Also, we have question banks that have thousands of POCUS-related questions from every discipline and allow learners to assess their own knowledge and gaps in a self-directed way, and the results flow to the dashboard. These Q banks are being continually added to, updated, and crowdsourced from our community. A recent exciting addition to the platform is the fellowship portal. Our fellowships pair learners with experts for tele-ultrasound sessions and deep dive longitudinal mentorship and expert scan review over a period of months that really turbocharge and optimize that process of achieving competency. This portal brings all of those pieces together in a structured way. The online modules, the in-person hands-on experiences, mentorship sessions, quality assurance, and assessments, all in one place with easy scheduling, performance metrics, and visibility throughout the process, which eventually leads to final multiple choice and real-time virtual assessments and certification of competency. And this really gets to the core of why we built Gussie, truly to scaffold and support individual learners and whole health systems with the right software tools and knowledge to scale safe, competent, and meaningful adoption of POCUS. Lastly, ScanHub's latest addition is Sage AI. Any learner anywhere can ask Sage AI any ultrasound-related question in almost any language and get an expert result in that language. Most importantly, because we've trained Sage AI on all of our educational content, our vast image library, thousands of hours of expert mentorship sessions, and a curated list of the best ultrasound sources out there, that answer is highly trusted and credible, much more so than ChatGPT or Google AI would be, which looks at the entire internet. So I simply type my question, and here's a question here: how do I do lung ultrasound to diagnose pneumonia in children? And I could ask that question in Danish, Urdu, or Mandarin, and get that expert, fully referenced, vetted answer 24/7, 365. And not only do I get that answer, which is fully referenced, but I also get images that relate to that answer. Right here, examples of lung ultrasound. Also will take me to the place directly in the Gussie course that relates to that answer, and it will even give me further journal articles that deal with that question. Our goal with Sage, as with our whole platform, is to democratize the knowledge, sustainably build the skill, and empower anyone to be able to confidently and competently use POCUS to improve patient care. In summary, Gussie is working to create a better world in which every healthcare practitioner is empowered to offer a rapid, reliable, accurate ultrasound-enabled diagnosis directly at the point of care for any patient anywhere. And we hope you'll join us on this mission as we continue to teach, to share, to empower, and to build communities. Thanks so much.